Yeah, it's
Hello, everyone. It's Carol Lourie, and I'm here with my dear friend and colleague, Dr. Stein, who is a functional medicine psychiatrist. Am I saying it properly?
yes.
Yes.
Yeah.
So it's not just psychiatry. It's
Mhm.
not like you go to the doctor and you say, I have depression or I have anxiety. It's like, what's going on metabolically and emotionally? And it's not just out comes a prescription pad and the next thing you hear is, oh, let's just put you on this antidepressant. So welcome and thank you for being here, Dr. Stein, and tell everybody about how you went from being a quote unquote regular doctor to becoming who you are as a functional medicine physician.
Yeah, well, it was about 13 years ago when I was actually working as a traditional standard, psychiatrist, conventional psychiatrist for 20 years and enjoying my job. I was a medical director at a community mental health center, and we were on a trip, and my son had an acute mental health crisis, something that we did not anticipate to happen at all. There was no signs or symptoms of it. Had a tiff with his brother, and before I know it, he is on a ledge, ready to jump.
Oh my goodness.
He's up. Yeah. So yeah, it was extremely mind blowing to me because here I am, a psychiatrist, right? You would think that as a physician and a mom, I would have picked up on, especially as a psychiatrist, would have picked up on any signs or symptoms. But I can tell you, other than what you see in normal adolescence, it was not there. And so, long story short, I had him seen by a psychiatrist, and he was put in therapy, and trying to figure out what's going on. Why did this happen? And we have family history on both sides of depression. I was told, well, be happy that it's just one of your three children, that's going through this.
Just one.
That's So, that's not, but why did this happen? It didn't make any sense to me because it just came out of the blue. It doesn't happen like that. There's usually stressors, there's usually something going on. And the symptom that he had that made me think there's something going on neurologically, at least that was the thing that I went to, not being a functional medicine doctor yet, was that he had double vision. So he went from a kid who was reading avidly that could no longer read. And we didn't even think it was double vision. We just knew that he couldn't read anymore. And so we had to put all of his books on tape, and some of these things we read to him because they weren't on, CD-ROMs at the time. Fortunately, his school was advanced enough that he had his books on CD-ROM. So he was able to continue his studies to some degree with some supports,
and it must have taken a while to even diagnose the fact that he had double vision. It's not like you take your child to the ophthalmologist right away or the optometrist to get their vision checked.
Exactly. In fact, this is a funny story, if you don't mind me saying. I was teaching him how to drive, and he was, it just happened when he was 14, 15 years old. And I was teaching him how to drive. And he said, Mom, which line do I follow? The line over here or a line over there?
Wow.
It's like, pull over, get out of the car. Like, what? No wonder he kept he was either overturning and hitting the curb or going farther out because he didn't know which line to follow. It's like, oh my God. So that's when we realized there's something neurological going on. So anyway, long story short, I was very frustrated with all the non-answers I was getting and being told that this is the way it is. He was on 4 medications.
So that's a comment, non-answers. And I know that the women in my community, and I've experienced myself, not with my family members, it's like you go to the doctor and you get non-answers.
Right.
Which is very infuriating when there is a major problem.
Exactly. And so he was on 4 medications.
Horrible.
Because he needed one for depression, one for anxiety, one for sleep, and then he had ADD, so one for ADD. And So, and this kid was like a zombie. He was not my child anymore.
Of course.
And it was a real crisis in faith in the system, obviously. And so I serendipitously found a functional medicine. I didn't even know what functional medicine was at the time. This was back in 2010. And I basically had him seen, and lo and behold, he was had celiac disease.
Oh.
He was nutritionally deficient because all he ate was white food.
Oh.
He had a lot of stress with social situations, making friends, and full of just eating junk food. He ate basically junk food. Even though I was a parent that tried really hard to get him to eat his vegetables, even sang songs about eating vegetables because I was singing at the time. And, it was really impossible to get him to eat the kinds of foods. He had issues with textures and, a lot of movement issues. And these were all signs and he had severe constipation, severe eczema. These are all signs
of gut disturbance, gut microbiome disturbance.
But he had all of these symptoms even before he had this mental health crisis.
But they built up. I mean, his body was trying to accommodate them. And this is the case with chronic disease, ladies.
Right.
Your body tries to accommodate and it keeps saying, well, I can do this. I can accommodate for that. I can accommodate for that. And then comes this tipping point.
Exactly.
And all of a sudden you're diagnosed with an anxiety depressive disorder, or you're diagnosed with breast cancer or some other quote unquote disease that you feel just appeared out of the clear blue, but really it was developing over many years.
Absolutely. He had these issues and we just thought that this was his normal, really severe constipation and eczema. And so
they go hand in hand because the gut and the skin are connected in the organs from Chinese medicine, right? The large intestine shows up in the skin, right?
Absolutely. So the tipping point for him was hitting puberty.
Yes,
that was it. Right. He was going through puberty. So a lot of these teenagers, when they hit puberty, they have all of these issues with their brain. It's really been going on for a while if you really look for it properly. So so what's interesting is once we started treatment with the functional medicine doctor, it was the eczema and the constipation that cleared up within a couple of months. It took about a year for the depression to clear. The anxiety is what's taken longer because of, like I said, and psychosocial issues was where the anxiety was from. But everything cleared up, including the diplopia, the double vision, of 2 years. And he was off all medications.
Thank God. Thank God. That's no way for anybody to live, really.
Exactly.
And you then went to the Institute for Functional Medicine and became an IFMCP.
Absolutely. Once you see that happen, I mean, once you go through that journey with your child, like you cannot practice medicine the same way.
No, hopefully you can't. Hopefully you can't practice medicine the same way. Unfortunately, some people do, because the world needs more functional medicine psychiatrists. Yeah.
I mean, I don't know how anybody could. So when you see something like that, you just can't just pill. I mean, I'm not saying I prescribe medications once in a great while. Certainly not every single patient. Once in a great while, I need to use medications. It's part of my toolbox. I'm not anti-medications. There's a place.
No, me too.
Absolutely is a place for it. In acute situations, there's a place for it, just like there's a place for surgery.
100%.
And you absolutely need to combine and use all the tools of your toolbox. Absolutely. So diet, removing toxins from your body, reducing stress to your body, mind, and spirit, and really doing a full gut restoration and really, giving your body all of these nutrients to support your immune system, which is the army that fights the battles on a cellular level for you, is really, really important. And so the gut needs to be restored. And so removing those pathogens, replacing the gut microbiome, and repairing that gut lining is so, so important.
Absolutely, 100%. And women who have been through breast cancer treatment, chemotherapy, radiation, surgery, any combination of that, and then put on hormonal therapy, tamoxifen aromatase inhibitors.
Right.
The worst. So they go into hormonal therapy and they've had their gut disrupted through active breast cancer treatment.
Right.
And there is a lot of emotional changes and stressors and trauma. And so it's no wonder that after active treatment, there's this tendency to put everything on the back burner and just get through it. And that's when everything hits the fan, and all of a sudden they're massively depressed or having horrible anxiety. And then they're placed on these hormone blocking medications that put women in what I call speedy menopause.
Right.
Which, menopause physiologically should happen slowly over a year to two. And all of a sudden, all of their estrogen is blocked in, a week or a month. And so it's no wonder that after active treatment, there is a huge increase statistically of women with breast cancer having depression, anxiety, and quote unquote bipolar, all the psychiatric diagnoses. And let's talk about how they can view this time and these upsetting feelings and emotions from more of a holistic and integrative perspective.
Sure. You just said a lot.
I know. I'm sorry. Talk a lot.
Adjusting. No pun intended.
Ooh, that was cute.
So, I think certainly when you get, just from the beginning, when you get a diagnosis, it's shocking, especially when you have, there are women who have a breast diagnosis and they think, they get angry because if they've done everything, I eat the right foods and I exercise and I do all this, why me? Right. So everyone has a different perspective with that beginning of the diagnosis. And there are other women who will feel guilty about all the things that they knew that they should have done that they didn't do. And why didn't I do it? And, and so, it is what it is. And it's a matter of coming to a place where you're going to recognize these emotions, acknowledge them, validate them, and express them as best as you can. And in breathing into these emotions, allowing for them to be there and not allowing, I would say, never let guilt, fear, shame, or anger get in the way of your emotions. Because a lot of times people will automatically have an emotion and then they'll have a reaction to that emotion.
That's an interesting concept.
Yeah.
I never actually thought about that. You have emotion A and then you have a judgment
right
to it, right?
Which is which can be not necessarily cognitive, but an emotional judgment. So feeling shame, fear, guilt, or anger, and sometimes then you make decisions based on those feelings. So it's a matter of trying to get underneath the original, underneath those heavier emotions, the fear, shame, guilt, or anger, and understand what is driving everything. It's really underneath that. You're covering that up. And it tends to be a low vibration emotion that is harder to feel, and it makes you feel more vulnerable, potentially out of control, or you think you're going to go crazy, or there's a deeper shame around it. So is really getting underneath that and breathing into it. And the one way to get underneath that is, where do you feel it in your body? Right. So if you can breathe into that spot where that emotion resides, and if you are into chakras, there's all these energy centers. You can breathe into the chakra that's associated with that part of your body and allow for you to, in your mind's eye, using imagery, to break up that emotion. And you should feel some relief, but sometimes as you're doing that, you'll have some images, thoughts, feelings, memories come up sometimes in a flash, and sometimes they're repeated. You may want to journal those feelings, thoughts, emotions, physical sensations, and memories, and look for some patterns. And it's a great place to then work through those things with somebody, a therapist, whether it's a therapist or a health coach that's understands these kinds of things, to work through. Because, ultimately all chronic illness comes, there's some meaning behind it,
100%.
The body keeps the score. So, and so resolving some of these quote unquote traumas, that everybody has trauma to some extent, whether it's a big T or a little t, And it doesn't have to be, you know, horrible parents. It could just be things that happen that you just happened to be in that place and it affected you in a way, especially during certain developmental stages of your life, that you were not able to, you know, compute. Like your brain is just either not mature enough to understand it, or you know, be able to negotiate what you needed at the time. And you know, so a lot of times people, when they talk about trauma, or they think about trauma, they assume that it has to be abuse or neglect or horrible parents or horrible teachers. No, it could be just your needs were not met at certain times in your life. And you'll know what those times are because they come up over and over again. They might be triggered over and over again in interactions or events that happen in your present life. So it's really important to be able to work through those emotions. And so, I mean, to answer your question, using that process throughout your whole journey, you know, from the beginning of your diagnosis throughout, you know, what comes up for you, and to just allow it to be without judgment. And, you know, if you can approach it with curiosity and exploration around it, and that will get you to a better place, at least emotionally. So, you know, and so that's just talking about your reaction and reactions to your reactions, right? We're not necessarily talking about the physiology that can occur as a result of treatment, right? And if you're having certain organs removed, you know, that's going to change, you know, how the balance of your organs, you know, obviously your hormones, not your organs, you know, are going to affect you. So that can certainly, hormones or lack thereof are going to affect your brain, certainly. So if you don't have that balance of estrogen, progesterone, and testosterone, then you're going to be affected on some level, you know. Yeah.
That was a great synopsis. And the things that I really pulled out from it are the body keeps score. Mm-hmm. And it happens on an unconscious level. So when a woman is feeling anxious or depressed, and I think they're very different experiences, and I don't like to lump them into one category.
Right.
I think anxiety happens when your psyche is trying to tell you something and it's knocking on the door. Hi, you need to pay attention to this, or you're feeling this. And your mind or your life is so busy that you're not able to answer the door and pay attention. Mm-hmm. So the volume of the knocking keeps getting louder and louder until you feel so bad that you have no choice but to stop and pay attention. And in our society, most people go to the doctor and report. Notice I'm not using the word complain, because it's not a complaint about how they're feeling. And then if it's with a regular doctor, out comes a prescription pad.
Right.
And what Dr. Stein and I are referencing, and our path through this, is about really, it doesn't just happen overnight. Right. And what happened before, whether it's a week before or 20 years before, that is now up in your psyche right now that needs to be addressed. And sometimes that requires some medication in combination with functional medicine and healing breath work or psychotherapy, but there is always a path through emotional distress. So the title for today is What If It's Not Depression? Is really relevant for it's not only depression, it's not only anxiety, it's not only, I had a woman I was working with who was diagnosed with bipolar, and I have a difficult time with that diagnosis because what happened for her is she had years of emotional suppression of not dealing with trauma that happened to her as a child, and her psyche couldn't handle it anymore, and she became overwhelmed. And as soon as we started doing functional medicine and therapy with her therapist, I mean, like all these quote unquote bipolar symptoms just disappeared. And she was on a huge amount of medication that we had to gradually taper her off of. So you don't want to get stuck with your diagnosis. Oh, I have a diagnosis of depression, or I have a diagnosis of anxiety. You want to look deeper.
Right. Absolutely. Look deeper. And, you know, depression and anxiety are terms, are words that, there are symptoms actually. So there's a compilation of symptoms. Many of them are physical symptoms as well that come together that create a disorder, and it becomes a disorder based on how much it prevents you from functioning, So, and these are all terms that are really brought together only to convey information and to match a pill to an ill, to give your insurance company a diagnosis so they know what they're paying for, and to do research. That's the purpose of having a diagnosis. I mean, I know that some people, get some relief from having a diagnosis, like, oh, there's an explanation for this. But honestly, it's not a true explanation. It's something that's recognized and is common. It's not like you're a zebra and you're the only person that has it. So it's nice to have this feeling like, oh, what I'm having is known by people and it's common. There are other people that are experiencing that I'm experiencing, but it doesn't tell you anything about what caused it.
No, right, exactly.
Nothing about what caused it. Nothing at all. And in a lot of times people use this word of disease in exchange with disorder, and in the DSM it does not belong in the DSM. The DSM says that it doesn't say anything about what's causing your symptoms. Nothing about what's causing. In fact, they took it out of the DSM-3. So all which is, when I say DSM, it's the Diagnostic Statistical
Manual, right? It's how disease is quantified and numbered for the insurance companies so there can be reimbursement. It has nothing to do with the reality of what causes your illness or diagnosis.
Yeah. So they're called disorders in that they're not diseases. It's not the same thing as a disease. So there are diseases that can cause these disorders. So it's looking for the root causes, and everybody has multiple root causes. It's not one cause. And so that's why taking a medication is not going to fix anything. It doesn't fix anything. It temporarily helps you have some balance so that you can function. And I think really what the standard of care should be is to use medications to be able to stabilize someone, just like you use, sending someone to the hospital because they've been in a car accident and they're bleeding. You go to the hospital to be stabilized, but then you might need casts, you might need surgery, whatever, but then you go to rehab. So the rehab is what kind of heals that process. The same thing is with mental health issues. You can use medications to stabilize you, but to me, sending someone home just on medication and doing nothing else is
it's a travesty. It's a travesty.
It's like a body cast, so people leave surgery and in the hospital with casts on, knowing fully well that they're going to go to rehab. They're not going to be left that way. And so I really believe that the standard of care should change in terms of psychiatry to not be leaving people on medication with no other solutions. And so my book actually talks about all of the possible root causes and solutions. And it's really important to be able to know how to do that so that you don't need to be on medications long term. Some people do. Hey, some people definitely do. But I think ideally the goal should be to try to be on the least amount of medication and to teach people the tools to be able to improve their lifestyle or understand what changed in their life, to be able to manage their emotions, and to being able to know how to respond to situations. And because then you can know what your Achilles heels are, right? What your strengths are and what your weaknesses are, and be able to change your lifestyle to be able to pad those areas and move forward. Just like if you were in sports, if you had a knee injury, you're going to do something different post knee injury than pre knee injury, right? If you want to continue to play sports. So it's the same kind of thing. So my son, he got well. He was really well after 2 years, but then, he went to college, right? Friends, they eat, he's living on campus. And so food
pizza
was,
and beer,
right? Pizza,
college food,
beer, exactly.
pasta.
He would stay up late at night because they're all vampires, you know, and then the stress of studying, so the lack of sleep. By the time he graduated, he was a wreck again, right? So, but he took the 6 months after school, knew exactly what he needed to do to get back on track, and he did.
Great.
He did. So, I mean, his depression and anxiety returned, you know, because of all the lifestyle.
1 + 1 = 2. That was good for him to see as an adult, now that he's like 21 or 22, and he had you and he had the tools to get right back on the path. So we have a couple of comments here that I wanted to address.
Sure, yeah.
One woman says, I'm having side effects from chemo, hair loss, neuropathy, being off balance, weight gain. I hate it. And I went through breast cancer in 2001. So it sounds to me like you're still having side effects from chemo. And what I want to say about that is once your gut is disrupted and you haven't done any repair work, it doesn't magically go away. So as Dr. Stein said, and I always say, you need to go through a gut repair program. And you can reach out to me on Facebook and I can work with you. You know, if you're in my group, The Path of Breast Cancer, a safe place, you can put a comment in there and I will respond. And then another Facebook user says, I'm tired all the time. And that can happen from chemotherapy. It can happen from hormonal therapy. And it can also be a side effect, as Dr. Stein has mentioned, of gut disruption or depression. So there's many underlying root causes for being fatigued all the time.
Yes, many. There's mitochondrial causes, there's adrenal causes, there's thyroid. I mean, there's so many things. And even just, you know, not being on the proper diet, you know, can cause people fatigue. I see a lot of, one thing that's difficult for people to see, especially if you're on a one-time visit with your doctor, is the blood sugar dysregulation is huge.
Oh, yeah.
You know, hypoglycemia, if you're eating a high carb diet and then your blood sugars crash, and then you might have some good days, and then you're eating, you know, so if there's a change in diet, so doing a continuous glucose monitoring is really helpful to really track that, especially if you're having panic attacks that are not like they're just not part of your usual.
They come out of the blue all of a sudden, right?
Right. Think about, oh, when was the last time I had anything to eat? Because if you're nauseous from some of the therapies and then you don't eat and then you get into this cycle of not eating because you're afraid you're going to be nauseous, then what happens? Your blood sugars drop and then you have a panic attack. So it's kind of, you have to put your Sherlock Holmes hat on, you know, and really connect the dots about when does this happen? What happened before? What was eating? Like, it's really thinking about and connecting the dots to figure out what is going on, especially if it's a symptom that's out of the blue, you know, like panic attacks. So even if you have a change in mood, that's just not like, oh, my mood's been fine, and then suddenly it changed, even though you may have had a history of depression and it gotten progressively better for whatever reason, then it suddenly comes back. Well, what just changed? What was in your diet? What did you do? What did you take? You know, try connecting the dots, and it helps to journal these things as well. So there's just even changing your diet. So one thing that's really good for cancer is a ketogenic diet. It's removing sugar out of your diet.
100%. That's one of the things I talk about.
Really important. And it's great for the mood. It's not just great for cancer. It's great for the mood. It really helps with depression significantly, as well as anxiety. So,
and sugar isn't just white sugar. Sugar is also simple carbohydrates like scones and muffins and over-the-counter pastries and crackers and gluten. So sugar, you know, we're not just talking about a mound of white sugar, which goes into pastries and over-the-counter pastries and cookies and breads. It's also simple. It's also white flour carbohydrates. So I think anything that's white in the food department should be taken off of the plate.
Absolutely. 100% agree. Absolutely. And it also, you know, if the candida is a type of it's an antifungal or fungal, kind of your yeasty kind of organism. I don't know how people understand candida, but it loves sugar. And a lot of times it drives
makes you eat it.
It drives you to eat sugar. So it's not your fault. So if you have that constant, even though you try really, really hard to eliminate it, and it's just like, oh, I have to have it, then it's probably something in your gut that's telling your brain, we want sugar.
Yeah.
Because when you treat that, believe it or not, that goes away.
It gets less. Yeah. If you can't get off of sugar, because I talk to women about this all the time, it's the foundation of my program. If you can't get off of sugar, then we need to look at what's happening in your gut, because as Dr. Stein has said, you have an environment going on in your gut that's saying, feed me, feed me. It's an unhealthy environment. And there are natural ways to kill that candida, turn the volume down on it. And so you're not craving carbs so much. I've had women say to me, I just can't not eat bread, even if it's gluten-free. I have to have a piece in the morning and a piece in the afternoon. And if I don't, I go into the state. So that is, that's an imbalance driven response.
Right. Absolutely. Absolutely. Yeah. So yeah, there is a lot that can be done, absolutely can be done for people who are having these imbalances. It's just a matter of figuring out what are your imbalances personally. It's not a cookie cutter approach,
That's the beauty of functional medicine. Dr. Stein, what's the name of your book?
It is called What If It's Not Depression? Your Guide to Finding Answers and Solutions. And it's on Amazon.
That's great.
Yeah. So yeah, I have a YouTube channel myself, and people are interested in root causes of depression. They can find it by the same name, What If It's Not Depression, with Dr. Achina Stein on YouTube, and be able to view all sorts of videos with experts about different topics about root causes of depression.
Well, that's really great. I mean, I think root causes is the way to go. It's root causes of depression, anxiety, breast cancer. We all need to go underneath, because when you just deal with the top level, you're doing symptom management, and there's always going to be stuff that pops up. So you're never going to be in this place of feeling like well. Right. And wellness and energy and vibrancy and looking forward to your life is really what we're all striving for, no matter how old we are. Right?
Absolutely.
Yeah.
Absolutely. Yes.
Thank you so much for being here, Dr. Stein. We really appreciate it. It was really informative. And ladies, reach out to myself or Dr. Stein if any of this resonates to you. We want to help you find a path through it. I mean, it's not only about medication, and it's not only about depression or anxiety. There's always a root cause, and using functional medicine is our way to help you discover what that is, right?
Yes, absolutely.
Yeah. Thank you so much, Dr. Stein. Ladies, it's been wonderful to hang out with you. It's Carol Lourie signing off for now, and there'll be more later. Have a lovely afternoon. Bye for now.
Bye.